Before we do our media availability with Jeff Gordon this morning, we have a press conference that's going to take place here for the first 15 minutes. Then we'll open it up for media availability. Once we get the props set up and start the press conference, please make sure any questions that you have to Jeff are related to this announcement. Any media availability or racing questions pertaining to the weekend will be addressed as a media availability immediately after.
We're good.
Good morning, everyone, and thanks for coming out today. As some of you may remember, last year Jeff Gordon and his wife Ingrid joined the Sounds of Pertussis campaign, a joint initiative from Santa Fe Pasteur and March of Dimes to help educate the public about pertussis, or as it is more commonly known as whooping cough. They want to let parents, grandparents, caregivers, and others in close contact with infants know how important it is to get vaccinated with an adult pertussis booster vaccine. Jeff continues to be passionate about this campaign because pertussis is still a serious threat and is on the rise. In 2010, more than 22,000 provisional cases of pertussis, including 26 deaths associated with the disease, were reported to the U.S. Center of Disease Control and Prevention. This year, California remains the state with the highest number of cases, but sadly, Michigan is close behind, ranking third in the nation with more than 400 reported provisional pertussis cases. Even these numbers don't paint the full picture, though, because pertussis is often undiagnosed, misdiagnosed, or unreported. Estimates suggest that there may be as many as 800,000 to 3.3 million adult and adolescent cases of pertussis in the U.S. in any given year. Given the high rate of reported pertussis cases and the fact that awareness of the disease, diagnosis, and preventive measures remain low, there is a continued need for pertussis education across the nation, especially here in the state of Michigan. That's why Jeff is here with us today to talk about the Race to Blanket America, the latest Sounds of Pertussis campaign initiative, as well as how you can all get involved in the race and learn more about pertussis. Without further delay, I'd like to welcome four-time NASCAR Sprint Cup Series champion and spokesperson for the Sound of Pertussis campaign, Mr. Jeff Gordon.
Well, thank you very much. Yeah, you know, this is about awareness, and it's unbelievable. A year later, after Ingrid and I started with Santa Fe Pasteur and Sounds of Pertussis campaign, that those numbers are still on the rise. So it's very important for us to still get the word out there. To those parents, grandparents, aunts and uncles, all those adults who are going to be around infants. This is about an adult Tdap booster vaccination because as parents, one thing that we have learned is that we're the ones as the parents and the caregivers that are putting our children at risk because basically when you're an infant and if you received a pertussis vaccination, one is it doesn't come into full effect until you get 3 doses, which could be 6-8 months, and as well as an adult, your vaccination wears off and you need a booster. So we became aware of this after Ella was born, which was really shocking to us, and got our attention because we put Ella at risk. But we didn't take any chances with Leo, so we made sure that we received the adult Tdap booster, and now we're continuing to spread the word because we believe in this program. We believe in how easy pertussis is to prevent because it is a vaccine preventable disease, and yet the numbers are still rising in across America. And so this year we're able to bring a little bit more awareness through the Race to Blanket America, and basically we're asking people to go to www.soundsofpertussis.com. And if you go in there and click on Design a Quilt, you can create your own quilt square. It's a digital quilt square that's on their website. Some really cool ways to get involved, interactive, create a message, and then we've already displayed this the current one, which had about 1,200 different squares on it from all the fans and different individuals that made their own quilt squares in Times Square. But it's growing rapidly since then, and the final quilt square will actually be in the Jeff Gordon Children's Hospital in Concord, North Carolina, when it's all finished. So, and the great thing about this program is that $1 will be donated to the March of Dimes for every quilt square that gets designed. So we just want to really continue to push the message and get parents and caregivers out there to to make sure that they're getting this Tdap booster vaccination and blanketing their child with all the protection they possibly can. Thank you.
We'll take questions now for Jeff. Please raise your hand. We'll start right here with Wolfgang.
Wolfgang Munzer from Germany. Jeff, just a question. Are you also working together with doctors and invest money in some research work, how pertussis can be stopped or can be researched to create medicine against this illness?
Oh, there's the medicine is easy. It's there, and in some cases it's free in certain clinics. It's very easy to access. Obviously, what we always encourage people to do is talk to their doctor or healthcare provider. I'm big on supporting what the CDC recommends, and I'm definitely pro-vaccination. And what we're talking about here is not just going along with the CDC's recommendations on the infants' vaccinations. It's also an added layer of protection, because what's happening in 80% of the cases with pertussis these days, because a lot of people think whooping cough is something of the past, that it doesn't exist anymore, but it does, and a lot of it has to do with the fact that our vaccination that we received when we were infants is worn off now, and so we're getting pertussis. And we don't know it. It's a lot less serious in adults and teenagers, and so you may have pertussis, and it might not be as serious, or you might not get that whooping cough sound, and your immune system can fight it off, but you're still passing it on to the infants that you come in contact with, and their immune system and their vaccinations have not fully taken effect, and they can get it, and it can be very serious. They can even die from it.
Okay, our next question over here from Brudenell.
Yeah, just for the record, my father's twin died of whooping cough, but that was back, many decades ago. Being involved in this, Jeff, and being a dad, how do you feel it fits in with your racing? And is it more important sometimes to think about these type of things than just going out and running around in a car?
Well, one of the great things that I loved about NASCAR when I first got involved was, as a young driver coming up, you want to do everything you can to fit into the sport, to represent sponsors well, and you start looking around at other drivers, and they're an influence on you. And immediately I was being introduced to children from the Make-A-Wish Foundation that were at the racetrack, whether it was through Jeff Bodine or Kyle Petty or other drivers. I went to local children's hospitals and met children. That was even back into the Nationwide Series, when I was in the Nationwide Series. So I got introduced to giving back and doing all that I could to whether it be meet or try to put a smile on a child's face that might be suffering from an illness or a disease like this. And so by getting introduced to it early on, it's become somewhat of a part of my routine, and it's something that obviously has grown over the years by creating my own foundation, and it's something that I'm proud of, and I try to put a lot of effort into. Obviously, my priority, when it comes to my work is to put as much effort into driving the race car as I can, and so over time I've learned how to structure my schedule to do what I feel like I need to do to be competitive in the race car, as well as be able to be a good dad and put as much time as I possibly can fit in the schedule into getting behind programs like the Sounds of Pertussis, taking a trip to the Congo with CGI, or a bowling tournament in Indianapolis. So it to me, it balances me out. I think it makes me a better race car driver by being able to incorporate children and you know the important causes that are out there that I've been able to get behind.
Okay, we have another question. Go ahead.
Robert Derogi from BRD Broadcasting. Jeff, I would guess with the complacency of people today, one of your biggest problems, along with the doctors, is, oh, I don't need that because modern technology is taking care of everything. Wouldn't you say that that's got to be your biggest problem?
Well, that's why I say this is an awareness campaign. This is, you know, to tell people, primarily adults, you know, that pertussis or whooping cough is still here. It's vaccine preventable. The vaccine is there. You know, it's the nice thing about this vaccination booster is it also will cover your tetanus as well. So if you need a tetanus shot, you know, get a Tdap booster shot because it's going to cover the tetanus as well as the diphtheria that handles the pertussis and the whooping cough. But yeah, that's the biggest thing is that, you know, we think it's something of the past because it used to be, you know, the standard of you know, you have to take care of this, and so, you know, parents were making sure that you know there was something more that they focus on, more something the doctors focus on, and they've told me that there are cycles that it goes through. Then it seems like every maybe 10 years it comes back onto the radar, and that's where we are right now. You know, we're back on the rise, and we need to get the word out there to people. And also, you know, there's a lot of theories out there on vaccinations in general with infants. So, you know, whatever your theories are on that, you know, I'm not going to certainly go down that road because I have my own, and like I said, I stand behind the CDC's recommendations. But you know, so between that and also the adult needing the adult booster is what's bringing pertussis back right now, and so we need to get the word out there for more people to be aware of this and ask your doctor or caregiver, you know, to what steps you can take.